Hello, thank you for tuning in to our website. My name is Jeffrey Johnsrud. I'm a physician and surgeon at St. Joseph Hospital and a member of the Bariatric Care Center here at St. Joseph Hospital. I'd like to tell you a little bit about our program and a little bit about the disease of morbid obesity. At our program here, we have been in the business or specialty of caring for bariatric patients for over 6 years. We've done well over 600 cases in that period of time. We do both lap bands and we do gastric bypass, either done as a laparoscopic procedure or on occasion as an open procedure as needed. The disease of morbid obesity is one in which a patient has a BMI of 40 or greater. In everyday terms, that's typically an excess weight gain of well over 100 pounds over the ideal body weight. Typically, a patient that has that problem of obesity will also have comorbidities, diseases such as diabetes mellitus, hypertension, sleep apnea or asthma, degenerative arthritis, typically in the lower extremities. Oftentimes there will be gastroesophageal reflux, hypercholesterolemia, and on many occasions anxiety or depression. Our goal in our multidisciplinary approach to the treatment of obesity is to deal with the excess weight and attempt to get that off, and in so doing, typically eliminating or removing the comorbidities. When a patient initially comes to see us, we'd like to have them come first to our community lecture, where myself or my other partners here at the center will give a free lecture that we do in the evenings and talk about all the aspects of obesity. Following that, typically a patient would come in to see us in the office in a private consultation. We encourage that you bring family members along as well. And in that situation, we talk about the disease, the issues that individual patient has, and how we may go about caring for it. At that time also, we go into great detail about the actual operations, the pros and cons of the different types, and what a patient can expect. Prior to any surgery, we like to have our patients take a series of classes with a dietitian. They also consult with a psychiatrist who deals specifically with bariatric diseases and works in the fashion of behavior modification. We also have support groups that need to be attended both prior to the surgery and after the surgery. We also have classes that familiarize a patient with the actual operation and their hospital stay. We encourage exercise and physical activity, and we have a trainer designated to work with our patients, and once things are set up, begin consulting with them and begin on a physical fitness and exercise program. The surgeries typically are an overnight stay in the hospital if it's a lap band, and usually 2 to 3 days if it's a gastric bypass surgery. The patient has a period of time where they're recovering at home, starting first on a liquid diet, and then progressing up to more solid food. During that period of time, we begin a more active exercise program and progress that up as the patient's conditioning improves and their weight begins to fall. What a patient can typically expect to find at intervals after the surgery is their weight will begin to come down nicely, their physical fitness will improve, and the comorbidities which I spoke of will begin to disappear. We expect our patients to get down to within about 20% of their 20% over their ideal body weight, somewhere with a BMI in the mid-20s. We follow our patients at intervals after the surgery, beginning at 1 week, 3 weeks, and then at 2-month intervals for the first year. Patients are certainly encouraged to call or come in whenever any special circumstances or situations arise. During that period of time, in addition to seeing the physician, patient continues work with the dietitian and certainly continues work in the support groups and with the physical trainer. We feel like we have a very comprehensive program. I think that you would enjoy meeting and getting to know the different members of the team that will be caring for you, and we look forward to seeing you in consultation. Thank you very much for tuning in, and we hope to see you soon.